The Universal Healthcare Access Coalition has slammed the draft regulations that Trade, Industry and Competition Minister Park Stow has published. Now, the draft regulations have set out a new tariff determination framework for private healthcare in the country. The UHAC says that the use of an exemption provision to the Competition Act to manage health policy is questionable, and it's also open to legal challenge. Now, the health organization says that the government's proposal to implement only minor selected recommendations of the 5-year-old health market inquiry in order to address high costs of private healthcare will do nothing to advance urgently needed reform of both the public and private healthcare. And Health Minister Dr. Aaron Motsoaledi recently complained about how private hospitals operate like airlines or hotels, charging patients depending on what targets the hospitals have to reach.
There was disagreement regarding acceptable bed occupancy rate because the amount of beds that are occupied in a private hospital also determine tariffs. The private hospital, they work more or less like the airlines or hotels, you know. If you are in an airline and many seats are empty, the airline is going to run at a loss. So what they don't tend to do, if the bed occupancy rate is low, the patients who are there are going to pay more to cover for the beds that are not occupied. So if you stay alone in a ward in a private hospital, you must know you are paying for all the other beds. These are there. Nobody will tell you that. They will just tell you your disease was very serious, so you're going to pay this. But basically you are paying for the other patients who are not there, who didn't come. So that was a second disagreement with the department. The third one was disagreement regarding property valuation, the replacement value. The healthcare provider, especially private hospital, they insisted that when they charge a patient, they must take into consideration the price of putting up the hospital. It must be paid for by the patient. In other words, if I build a huge hospital that cost me 20 million rand, patients will have to pay for that when I start seeing them. Now, that was not necessarily rejected. What was rejected is this. They insisted on a replacement value rather than a value of the initial cost.
And that was Health Minister Dr. Aaron Motsoaledi speaking last week, or was it a few days ago? But for more on this, we join on the line now by the Universal Healthcare Access Coalition Steering Committee member, Dr. Mvuyisi Mzukwa. Dr. Mzukwa, thanks for your time. Welcome to Update at Noon.
Good afternoon to you, Sakina, and your listeners, and thanks for inviting me.
Firstly, Dr. Mzukwa, you say that the current developments are one-sided, they are ineffective and will not go too far in improving access to private healthcare, and it's not addressing the needs of an integrated public and private healthcare system. Is that correct? And if so, do tell us more, please.
That's correct, Sakina. First of all, I think the negotiations or even the conversation that we're having now, it started long time ago, in 2004. But in 2010, there was a proposal, a proposal that spoke to what we're talking about today. And that proposal was very comprehensive. It was even quoted by the Health Market Inquiry when it was doing investigations. And that was the proposal that was started by the same minister. But he abandoned that process altogether until they started the Health Market Inquiry. Now, the Health Market Inquiry came up with recommendations, and it did not just cherry pick on tariffs. It talked about a holistic reform of the healthcare system, the private healthcare system. And, because what you're having now, this block exemption, it only speaks to tariffs. And you are only targeting or you are only focusing on doctors. You are not saying anything about the hospitals. In the media briefing, the minister was complaining mostly about the hospitals, but when you come to the gazetted recommendations, there is nothing that talks to that. So that's one thing. You can't cherry pick on the recommendations. You have to be holistic. That's the first thing. The second thing is that if we are not going to be treating or regulating the private sector, it is going to impact negatively on the public sector as well, because those patients that cannot afford the private sector are going to fall back to the public sector. So it is in the interest of the country to be regulating the private sector and not play the blame game, because if you look at the recommendations, Sakina, the report of HMI, it speaks to the fact that it was the Department of Health that lacked in stewardship. It blamed the Department of Health. It's in there. Secondly, the issue of cherry picking. There is a specific section that says if you are going to be implementing, don't cherry pick. Just implement holistically. So that is what we were saying is a problem. But the last one is the issue of the legality. There is no legal basis on which this is done. It's just people coming together, one department instructing another department to do something. It's not regulated. It's not legislated as it was in the proposal in 2010.
So how do you propose this is done then, Dr. Mzukwa? Because you agree that even though you say it's cherry picking, but you agree that there does need to be better regulation of the private healthcare sector, especially when it comes to tariffs and how those are determined, if I understood you correctly. So obviously, controlling the cost of private healthcare would be a vital component in achieving equitable access to quality healthcare for all. So how do you propose we go about this?
Well, we think, first of all, if there's going to be a forum, a multilateral forum that is going to be, that is recommended, it must not be voluntary. It must be, everybody must be forced to be there. It must be mandatory. Because if people, if we continue to make it voluntary as it is now in the Gazette, people are going to opt out and say, I don't want to be part of this. So why should, how do you control that? But secondly, we are saying, it can't be, those people can't be managed, but can't be appointed by the minister, because in the Gazette it says the Minister of Health is going to, because what happens is that then the minister decides who they want to appoint, and then they manipulate the system, because once you have a political appointee, they have to be loyal to the minister. That's the other thing. But the other thing that is very important is that there are no time frames. It talks about 3 years. You can't be having those tariff negotiations happening, waiting for 3 years. They must happen early. So that medical aids can be in a position to price their members based on the negotiated prices. But lastly,
so the members have to pay. The members will have to carry the cost.
Yes, the members have to carry the cost. That's why we have to, on an annual basis, have these negotiations, agree. If we don't agree, we go to arbitration. Arbitration, it must be given authority to say, when it comes to arbitration, you can't take it to court. It must end there so that it is not dragged all the way. So in this case, there is no space for that arbitration, which was in the proposal in 2010. So we're saying, it's a very, I don't know how to put it, but it's not a structured approach, where people can complain and then those complaints can be handled timelessly so that you don't delay the implementation.
And then I hear you, and perhaps we need to set up a different time to take this forward, Dr. Mzukwa, because with the members having to carry all of these costs and, looking at how exorbitant medical aid costs are already, where do the members complain? How do they give their input about how all of this is affecting them? Yes, doctor.
Yes, Sakina, the other thing, when we look at cost, we have to look at, at the value chain. You've got a doctor, that will write a prescription, pharmacists. So it means pharmacists as well will have to be regulated. doctors will also send patients for admission in hospital, you know. They'll send patients for theater and all this for operations. So that environment, it's all what comprises the cost of healthcare. It's not just a consultation fee.
Yes.
I mean, it's very simplistic if you do that.
Yeah, absolutely. Because the other thing that you said earlier as well, Dr. Mzukwa, is, if patients, for example, can no longer afford what is charged at the private healthcare facilities, they will then have to go to the public facilities. Well, that is already happening, because when you run out of funds in a private facility, they don't ask. You are immediately ejected and you go to a public facility, which means the government then has to pick up the tab for what happens beyond that. So these are all things which I'm saying. I wonder where the consumers like us come in. Where do we give our input into all of these matters? Or are we simply there to carry the cost, as you say?
I think, Sakina, there should be, we can't be leaving consumers out of this. I think when we have that multilateral forum where we do negotiations, there has to be a voice of patients right there. You understand? So in this case, you have a minister who's going to cherry pick and decide, no, Mzukwa, because he disagrees me on NHI, let me pick so-and-so who agrees with me. So it's not structured at all. It's going to be manipulated by politicians if we allow it to go like this.
We need more time, because I think from a consumer perspective, it could be problematic from both sides, given how things are playing out at the moment. But Dr. Mzukwa, we have to leave it there for now. Thanks so much, Dr. Mvuyisi Mzukwa, Universal Healthcare Access Coalition Steering Committee member.